Hello and happy Monday, everyone. Welcome to New Academy. We'll just wait for others to join us. As we wait, I just want to explain how our new academies work here at New Viewer. Every Monday at noon, myself will conduct a weekly seminar to teach you more about what New Viewer has to offer and how we can help you with your success. So today, with our webinar, we will continue the journey of our 4-part series of Cosmelan and Dermamelan depigmenting journey. And before, here we go. Oh, we're having some technical difficulties. One moment, please. Fantastic. So here at New Viewer, we back some of the best known companies around the world. Our mesoestetic that we're going to speak about today is a science-based company from Spain. They are the leaders in depigmentation and anti-aging. Dermaceutics from France is a gorgeous selection of products and treatments that will support everything you're doing now and work synergistically with mesoestetic. New Year is a fast-growing company, and we are adding to our portfolio every passing day. So get on our website, check it out. It's a great interactive site, so you can communicate with New Year and with others around you. And of course, we have our Aptos thread lifting methods. We are just waiting on approval from Health Canada, but are excited to bring this award-winning suspension threads to Canada. And of course, if you haven't heard of our Phedia High Tissue PRP, you need to hear about it. Phedia has delivered the #1 world-winning PRP system that makes it easy to use. It is amazing with its concentration. So please reach out if you want to learn more about Phedia. It is absolutely revolutionizing PRP. And of course, New Year wants to be your one-stop shop. So we do offer you medical supplies with over 50,000 different SKUs. So check it out on our website. And I am Pina Lee. I am one of the clinical educators here at New Viewer and here to support you any way I can. So let's sit back, get a pad of paper, and take some notes. We are going to continue our 3-part journey of the Cosmelan Dermamelan journey. And today we're going to talk about that experience, what the client's going to feel in the clinic and at home for both of those treatments. So I'm going to break this down. Like any good series, we're going to recap what we are treating of those indications. We're going to just do a quick recap of your Cosmelan versus the Dermamelan and what each one is specifically geared for. We're going to talk about how the skin behaves, the largest, most amazing organ of the body, in my opinion, and how it reacts to damage, because that's what we do as medical aesthetics professionals. And of course, on application day, we're going to talk about that home protocol phase and what goes on during that time, potential skin reactions that might come up for that client, and how to get those clients to comply. And of course, the supporting products and how we are here to support you. So let's take a quick journey about melanin-based pigmentation. It's going to be on those exposed areas of the skin when we're talking about solar damage that's been exposed to that UV damage. It could be darker in some places, lighter in others, shows up for drivers on the side that faces their window. It is a cumulative, which means you don't necessarily have to be out sunbathing on the beach. That quick walk to the mailbox, popping in to grab your kids at school, all those moments of daylight outside is going to cause solar damage that will build up and kick in the derriere in the future. Of course, our PIH, post-inflammatory hyperpigmentation. So you suffer through acne, you suffer through a horrible waxing treatment or whatever, and even other treatments that are light-based or medical-based. We cause a reaction in the skin where the skin inflames, natural process. However, with that inflammation can come that risk of hyperpigmentation, especially in our darker skin types. Ephelides is a fancy medical term for freckles, so we can treat your freckles if you do choose to rid yourself of them. And of course, one of the most challenging, resistant to treatment types of pigmentation is that melasma. And for a lot of facilities out there, the reason why they turn to Cosmelan and Dermamelan as something that is missing in their facility. So melasma is, you need to think of it as a chronic skin issue, something like thyroidism or diabetes. You're not going to cure it and get rid of it, but you will manage it, reverse the visible applications of it so you don't see it, and then push it down and manage it. So as well as the body creating melanin through melanogenesis and causing that hyperpigmentation, these internal and external triggers also add to our issues. And when you are on this journey, that client has to understand that they need to be a part of the journey. You don't have a magic wand. Yes, you have an incredible tool in Cosmelan, in Dermamelan, tested and tried to do the job, but they need to support you in your effort. So manage their sun exposure, stay out of the sun, cover up. When you're indoors, reapply that sunscreen because you're still in front of computer screens. You're under that light with that forced air that causes hyperpigmentation. We got to take care of our stress. Now, I wish I could tell you the answer to deal with stress, but for me, I meditate. You just got to keep yourself calm. You got to make sure that what you're taking for medication, supplements, is not going to interfere, that you're complying with that photosensitivity and being aware of it. And of course, your choices, how you eat, how you drink, what you choose to drink and eat, how you sleep. So really help that client understand that this is a two-person activity and they need to support you. So melanin process, basically, it is caused in this beautiful little melanocyte. That's the factory with the porting exits, those dendrites. And when that melanocyte goes crazy and makes extra pigmentation, it gets deposited by those melanosomes up to that surface of the skin. So we are going to, yes, peel off that top surface, get rid of the old, expose the new in order to reveal clearer skin. But we need to go beyond that. And that's why you need to trust the experts. The world-leading depigmentation solutions based in science and focused on safety and efficacy. And these are both amazing treatments. The Cosmelan is your professional depigmentation treatment, which means it is performed by a skin professional. It will not only correct the surface by peeling away that dark, uneven melanin-based stained skin, but it's going to get into that melanocyte, regulate that action. And that's why it makes it such an amazing pigmentation treatment for that melasma, that solar, that PIH, and those freckles. And that pigmentation, the indication for Cosmelan is pigmentation in the epidermis. So it is tried and tested by over 1 million around the world and trusted by countless professionals around the world. So as I recapped, it's going to work on the top and the bottom. I love this slide because I love to say to our partners, our clinic partners, take this slide, reword it, keep the picture, put it in your clinic speak so your clients understand exactly why this treatment works and exactly what's going on with their face. So it's going to correct that top, heal off that top. And that's why that journey can be such a challenge for a lot of people. And then we're going to continue to teach that melanocyte to properly work. So if you do not continue, it is not going to complete that process. And that is why you need to follow it. Cosmelan, I really want you to absorb the ingredients that are listed here and understand that with the Cosmelan system, the active ingredients are the same. In that Cosmelan 1, which is your professional mask that goes on the face in clinic, they are the exact same ingredients as Cosmelan 2. However, it's at a lower formulation of concentration so that the skin can tolerate it daily and up to 3 times a day. So when you look at these acids and the purpose of each of these acids and ingredients, you need to understand they are top quality, which means they are very potent, very, very focused in specific actions. So with that salicylic, it will be spicy. I've never had a salicylic treatment that didn't get me tingling. With that azelaic and that phytic acid, you are going to see the renewal of that skin. So please keep in mind, these are very potent medical grade type ingredients with the focus. Well, in Cosmelan, they're professional, but they're at that level where it's a medical grade line. So your Cosmelan treatment is that it's got the 2 types of protocols, your in clinic plus your home. And the home protocol is that step down. So you use more of the actives in that first month to do that continuum of depigmentation. And then we reduce that application of the actives and start to work in the base of that epidermis to regulate and control. So it's very methodical and like that for a reason. To recap that application in office, it is a one-time visit for the application. The entire jar is placed on the skin. They go home. They don't have to sit and wait for 8 to 12 hours. And then they will continue with their next protocol, which is their home protocol. This is where we're going to drop into the different phases, reducing those acids and controlling and regulating that pigmentation process. So that is a little recap of your Cosmelan. Dermamelan is our medical solution for depigmenting. So what does this mean? With our reformulation and repackaging, and it's just got a whole new look and it's much safer, more tolerable, and more effective. So this is for your dermal hyperpigmentation. It not only gets rid of that vascular pathways for melasma, so it's going to treat your melasma, it's going to treat your post-inflammatory hyperpigmentation deep in that dermis. It is going to stop those pathways. So working at before the melanocyte, at those thought processes that are being made in the body to send those messages to those melanocytes. So this is where Dermamelan becomes a medical treatment and goes beyond that epidermis, beyond that melanocyte, and into the pathways. And the best part, it is an amazing anti-aging treatment. So you are going to get that reduction of pigmentation. You are going to get that reduction of wrinkles, smoother, tighter skin. And like the Cosmelan, it goes beyond the peel. We are going to do that corrective process at the surface, healing away, shedding away that dead, dull skin, bringing out new skin cells, and then regulating, talking within those cells and between those cells. So the ingredients, very different than your Cosmelan. We have that diazomin, that ferulic acid, and that retinol, which makes up our unique Sigma pigment target complex, which is just exclusive to mesoestetic. And we have that melaphenone, which itself is a brilliant new molecule they've created. You're adding in gorgeous resorcinol, kojic, salicylic. So again, just let the magnitude and potency of these ingredients into your head, because these clients are not only using it in that Dermamelan mask in office, but they're using those same ingredients every day for those 4 months. So yes, there's going to be a reaction. Yes, it's going to be a spicy time, but it is tried and tested and very safe. You just got to be prepared. So just to recap those 2 patents, which I absolutely love, that melaphenone, which is their own molecule, made their own molecule. So this itself goes into that trizinase and next to it and reduces its activity. That retinol, ferulic, and diazomin on its own can do amazing things. But know what it can do to the skin and how it sheds that skin. And now we're going to put them together and make them work 2 times better than on their own. So these ingredients are beyond anything that we know. And like that Cosmelan treatment, it is a balance. You do get that intensive correction and depigmentation happening in office, but that corrective continues slightly with that, gradual flaking of that skin. But that's where it's going to get into the nitty gritty. And as I said, it's going to control, regulate, re-educate, and keep it the way we want it clear. So it's now 4 hours for every face with that ion mask. They're going to go home 4 months, twice a day. So elimination of that step down program. And for your clients, this also is a great slide to show them the difference in those 2 beautiful treatments if you're going to use them both. You've got your Cosmelan, that's non-aggressive. It's that professional treatment. It's got a longer mask wear, longer home protocol because it is professional, more open to more faces. And it's going to do the job best if it's followed. Our Dermamelan is that medical option, 4 hours, 4 months, twice a day. It's got that ion mask to decrease that exposure time, make it easier to come off. And it is for that dermal pigmentation. So review those former webinars that I did create for the consultation and the prep, and know your animal, know which one's going to be used. So when we're talking how the skin behaves, rejuvenation treatments, there's so many ways to damage the skin, but it all involves breaking down of what we have existing promoting a faster, accelerated renewal of new skin cells. So whether you do microneedling, laser, or chemical peels, or any other resurfacing treatment, the skin is damaged and the skin doesn't have a handbook. Okay, well, what are we going to do this time? What's our play? It's going to go through that same process. And in general, that skin undergoes a series of very complex physiological responses as it heals. And, it depends on how deep, how aggressive that treatment is, that it's going to go through those steps very quickly, combine them in one or two movements, or it's going to be an extended process. So the more superficial that treatment is, it's going to result in that mild redness and peeling. The deeper you get, then it's going to start triggering that collagen remodeling, that tissue restructuring. So the first thing that's going to happen is that immediate response, that inflammation. And that's that immediate response. You've got that red blood cells and all those blood cells dilating because it's bringing more blood to that area. Those white blood cells come to fight that potential infection. That happens whenever the cell gets interrupted on its daily job. And then it can come with edema, which is a little different than inflammation. Inflammation involves those vascular, your vascular vessels, your blood vessels. But with edema, it's more that accumulation of the fluid in that damaged area. It helps to keep all that damage there, so it gets all swollen up and puffy, and it's almost like you can leave your fingerprints in it. Then, of course, that word pain. I was taught as an esthetician, we don't use the word pain. We talk about discomfort and sensations. However, the word pain isn't always necessarily bad. It could be just a little, pick. But what it is, it's those nerve endings talking to our brain and being a signal to the rest of our skin, and just letting everyone know something's going on. Something's not the way it is every day when I'm a skin cell going to work. So I need you to know something's going on. So it's just saying, look at me, I need attention. And when you're renewing that skin, those new little skin cells that you're showing once that skin is peeling are going to be more sensitive. Now, if that damage is deep enough and you've got enough of that skin off, you're going to have little scabbies and you're going to have clotting. And that's what scabs are. It's just the clotting. And that, again, is to get that skin intact. Skin cells got one job. They're all born the same. They differentiate and they got one job. Whether they're blood cells, skin cells, they're all made. And then they go to work. When their work is interrupted, their messages are interrupted because there's an injury, everyone's got to fix, and then they can resume. And that's what the whole journey of Cosmelan and Dermamelan is about. So on that application day, be prepared. Remember, you've prepped that skin. You've consulted with that client. You've gone through a great explanation of the treatment, what to expect. You've done your analysis. You've determined where that pigmentation is. And now you've also prepared that skin. And I've talked at length about getting them acclimated to our products like a little fish going into a new tank. You don't just dump them in. Get them ready. You put them in his bag, put the bag in the water. So get that skin ready with mesoestetic products. And it can be simple. If you want simple, ask me. So day of treatment, they're going to come in. They're not going to come in from the gym. They're not going to jog over in 90-degree weather. They don't want to be sweating or in physical exertion. They want to come in with clean skin, a hat, glasses, and no outdoor activities. Wear a loose-fitting shirt, preferably one that buttons up or zips up for easy removal. You want to make sure their hair is back and they're ready to go. They've cleared their schedule. They're not going on a shopping spree or doing a talking tour on Toronto. They are going to go home, clear their schedule, and put themselves into pamper mode. Okay. So they're going to apply. You're going to cleanse that skin thoroughly. The brightening foam is a beautiful option. We're going to then, on a dry skin, degrease. Give it a good rub in there. Make sure that that debris, that oil, that excess is gone. It's a solution of acetone plus your alcohol. So it's a great way to degrease that skin. And as I said, penetration, if you don't have a degreased surface, if you have too thick of a stratum corneum, where is it going to go? Nowhere. So degrease that face, wait for it to dry. Use your Meso Lip Protect to protect those eyebrows. If they are hair dye colorers, people that color their hair, then protect that hairline because you don't want any kind of reactions. And then apply that entire pot over the face. Ensure you schedule those treatments early in the day because they're wearing it for a few hours. So 8 to 12 hours is that exposure time. And here's a pro tip. I love my pro tips. Take your gloved fingers, rub that beautiful mask into those indicated areas, then smooth it out. For Dermamelan, very similar. However, you're more flexible when it comes to scheduling because it's just a 4-hour exposure time. So you can do it later in the day, unlike that Cosmelan. Again, cleanse that skin thoroughly, dry it, use that degreaser, get in there and degrease that skin. Apply that Meso Protect around those lips and everywhere else, nasal wings. And then use that entire pot of Dermamelan, mask onto the skin. Cover it with your ion mask. Some little notes to keep in mind. Whether it is your Cosmelan 1 or your Dermamelan mask, it is going to have a creamy, beautiful texture and beautiful consistency. It should not be grainy or lumpy or dark. It looks and feels like peanut butter, but doesn't taste like it. Don't try it. And it is a clay-based mask. So don't open it the morning of your treatment and leave it open. This needs to be open when you're ready to apply it to the skin. So be mindful and how you use and treat your products and what they should look and feel like. The application itself can be performed with a gloved hand. I've seen lots and I've done it myself where I remove it onto my hand and then place it or just remove it from the jar and place it with my hands. You can use a tongue depressor or a spatula, even a silicone brush. I don't recommend a hair brush, like a natural hair brush or synthetic brush with bristles, as it is clay and will stick. So unless it's disposable, use those options for application. Once it's applied to the skin, move it down, carry it down the jawline. Avoid too close to the mouth or around the eyes because it will migrate. These ingredients are designed to target, so you don't have to get close. And the closer you get, the more skin reactions you're going to have in those areas. For that Dermamelan ion mask, you can even cut those little nose pieces here for better contouring. So if you have any other questions about applications, throw some questions into the chat box and I'll answer them as we go. Now they're going home. So on that treatment day, they've got this beautiful baby poo-poo color mask. For the Dermamelan clients, they've got their ion mask over it. So it's going to keep it more gel-like. Both of them, there may be some tingling sensation in the skin due to those high number of concentrated actives that I showed you. During that duration, the degree of sensation and how long it's going to last is going to vary from face to face. But it is very tolerable. Most people can just go along and relax that day, keep that face calm and cool. It may get tingly and may get itchy and cool as it stays on the skin longer. Remember, it's staying on the skin from 8 to 12 hours. So you're going to stay home. You're going to keep that mouth from moving. You're not going to deliver a webinar on the day of your Cosmelan or Dermamelan. Yes, that Dermamelan will have the ion mask, but with that Cosmelan or Dermamelan, you want to think relaxation, calm, relax, avoid UV radiation. With the Cosmelan, as it dries out, and especially depending where you are in Canada. I mean, some parts of the country, we need to use our furnace a lot longer and a lot stronger than in other parts, or our air conditioning. And those environments can dry out our face and dry out that mask. Now, it's not going to dry out totally. Hopefully it doesn't. But if it does, grab yourself a little spritz of regular plain tap water, lightly, sparingly with water, and just smooth it back in to activate it. So that's in extreme cases of dryness near to the end of your time. You are going to remove this mask with lukewarm water, just plenty of water. Your skin is going to be sensitized from all these ingredients. So just water. When it's done, pat it dry. Some people, even at this point, they just get slightly pink. Others are pretty red. Some don't feel it till the next day. But regardless, apply a generous amount of your Melan recovery and should be close to bedtime if you've planned it properly. Now, those couple of days, those 24 to 72 hours post peel, this is where that experience again, for every skin experiences everything differently. However, in general, it's going to get red. It's going to start to get swollen and tight, a little irritated and warm. It's those first few days that skin is just reacting from that initial peel. You really need to be conscientious of adding that Melan recovery, using your Melon sunscreen 50 plus, and of course, wait till that sensitivity of the skin is managed from that initial peel before we start that Cosmelan protocol with Cosmelan 2. So in extreme cases, then you're going to postpone it for 2 to 3 days. Make sure you're drinking lots of water, managing that skin post-peel, like any skin post-peel. In that second phase of your Cosmelan, this is where we're going to continue to depigment. So we've put that initial mask on, remove that mask. Now we're into starting with our application of that Cosmelan 2. Ideally, you want it 3 times a day, and that's the program. The skin is going to start to get dry and tight because it's getting ready to peel. And most people can peel anywhere from day 3. On average, it's usually day 5, but every skin is different. Are they drinking water? Are they managing their stressors and other triggers? If you have excessive redness, then if you have to reduce the number of applications of your Cosmelan 2. But ladies and gentlemen, you must remember, you are putting acids on skin that's renewing. So like I said earlier, those new skin cells are going to be a little more reactive. Just be patient, persevere, push through it. Your skin will start to tolerate it. And that again is why it's so important to prep the skin, get them accustomed before you bombard them. You need to ensure that client avoids picking or peeling at that shedding skin refrain from using makeup on that red irritated skin. That Milan sunscreen 50 plus, shake it up really well and use it. It's got a nice little coverage of color for you. And of course, when they are ready for their makeup, then they can recommend a mineral based. Okay. In that following week, your day 18 to 14, for some, it's going to still be irritating and shedding and peeling. But for most, that shedding is going to stop. It's going to come to an end. It's going to probably start at your mouth, get tight, and work its way around and finish off with the hairline. Now, and there are rare occasions where people will peel for a lot of that process. And again, get that hydration. There must other factors involved. In these times, especially in the beginning, use that Melan recovery as much as needed. You can apply it as often, as frequently, and as much as you need. Now, yes, manage symptoms, but don't use so much that you don't peel anymore. You still want to get that peel off and get that old dead skin going. As the skin renews, it can feel raw, as I said. So just reduce those number of applications or even blend it with that Melan recovery, the Cosmelan too, every so often to give your skin a little bit of a break. As you go through that renewal process, that pigmented, dull skin will peel off and new, beautiful, sensitive little cells will replace it. So protect like your life depends on it, or your color depends on it. When you get into the end of that first month, so you're finishing off that phase 2 of Cosmelan, you are going to see beautiful results. Most people can see visible results as early as day 15. So that's why picture time, get a picture in there. That flaking process may continue for some. There still might be some irritation because we're still using those actives 3 times a day. So remember, no more than the size of a pea, reduce when necessary, and get that client to slowly build up the tolerance. I mean, when we first introduced something like a retinol to a daily routine, we explained to the client, start it once a week, work it in gently, slowly blend it in. But then we get so excited of the idea of getting rid of our pigmentation, we dive into Cosmelan, which is way stronger than just your regular retinol. So be mindful, work smart when you're dealing with that skin renewing and being more delicate. Personalize, tailor, but always keep in mind, we want to get to that optimal usage, 3 times a day dosage, stepping down. You're also going to find by the time you get through that pigmentation renewal of that skin, that corrective process, that skin's texture is going to be so much smoother. Those fine lines and imperfections and pores are going to be more refined. Like, even though it is quite a challenge to persevere through that shedding process, it is worth every moment. Now, of course, ladies and gentlemen, keep in mind at all times, it is a melanogenesis cycle we're dealing with. That means that it's not a project like, okay, we're going to build that house. It's like cleaning a house. We got to do it all the time. So with melanogenesis, it's going through its process of creating, every time there's renewal, we got to make melanin. So you're going to see that regression. You're going to see that skin get darker. It's okay. It's part of the roller coaster ride of getting rid of depigmentation. So now we're at the second mark and we're going into that second and third month. We are now at phase 3. We have done that correction and we're now regulating. Ladies and gentlemen, this is a crucial time in your client's treatment as they're going to feel like, oh, We did it. High five. I'm good. See you later. But this is where we need to keep them compliant. This is where now we've moved that focus from corrective to regulating or re-educating those melanocytes to regulate that melanin production. So you'll also find as we reduce that number of applications of that Cosmelan 2, that skin is going to be more tolerant and it's going to be able to take in those actives much nicer. But that skin needs to be healthy and intact as well. So make sure you manage those reactions. And we're going to speak about that. Again, through this next phase, as we're regulating, we are going to see that pigmentation lighten, darken, lighten, darken. Don't get worried. The clients start seeing it darkening and they freak out and then they stop. So explain to them, let them know what they're dealing with, that this is like, rah, rah, rah. It's like a waves coming in. And every time we reduce the amount of water, those waves are going to get less until there is no more. So that's what we're dealing with. In phase 4, and now we are at the tail end of that 6-month protocol. We're into that 4th, 5th, and 6th month. Again, that darkening of the spots can come back. It's okay. It's just that process learning. But this is why it's crucial to keep with that Cosmelan 2. Prevent that bounce back of those spots, especially with melasma. This process from that month 4, 5, and 6 mark, that is where we reinforce those long-term results. They've put in the time, the money, and that first month of reinventing that skin. So why would you want to pull the carpet out of your treatment and stop when you're going to maintain and control? And then finally, here at day 180, final day of the journey, you will achieve up to 80% of that depigmentation with your Cosmelan. For Dermamelan, because this is a different process in the sense it is a medical procedure, you're going to have more intense and more severe possibilities of your localized skin reactions. However, with that initial day, that again, it is just 4 hours, it's going to be a lot easier to come off. You don't have to deal with it as much as you do your Cosmelan and keeping it moist, because that ion mask will do that for you. It also makes it easier to remove because you can use that ion mask to pull off some of that clay mask beneath it. Again, remove the remainder with lukewarm water and apply your Melan recovery. All those gorgeous acids were on the face being driven in by those ions. So again, that skin can vary from a little pink, very tender, and knowing something big happens. So off to bed, the rest of your day, just use your Melan recovery. If it's still daylight, use your Melan sunscreen 50 plus. And then just like the Cosmelan, you need to let that skin relax. And in Cosmelan, you'll actually make it longer than that 24 hours, minimum 48 hours. My apologies, I didn't change that. So 48, even up to 96 hours for that skin to just come down off that peel. That face, again, is going to vary from very skin to skin for the reactions, but they're going to feel warm. They're going to feel tender. And they are going to avoid everything, relax, and just wait. Once you give them the clearance, then with the home phase, there's 2 parts because there's no stepping down in Dermamelan. They're going to have that procedure in the clinic office. They're going to go home. They're going to relax for those few days. Then when they start within that first few days after mask, this is where they're going to have the most challenging portion of this treatment. Now, this is medical, so it's more intense. It's going to involve more changing than in Cosmelan. So prepping for this is crucial. Making sure that skin is intact and healthy. Then you would go with that gradual depigmentation and control regulation. You can see that flaking and that localized reaction of erythema, that redness, that stinging, that burning, that irritation, that can last longer than those initial couple of weeks with Cosmelan, right into month 1, even up to month 2, depending on the skin. Some clients, especially if they're mesoestetic users and they get those medical treatments and they come in for mesoeclat and they do the different treatments that mesoestetic has to offer and use those wonderful products, they don't have as many or as long as that period of tolerating and adjusting to those home products. So this will show you as they stay on, it is going to continue very minimally and then recede. So what are those potential skin reactions? Well, there's redness. Again, the skin can go anywhere from light pink to deep red tomato and stay like that for the first month. It's changing. It's fading. That edema, puffiness. Oh, if you put that Cosmelan or Dermamelan too close to the eyes will puff up. It's going to happen. It's okay. Now, if you're truly concerned, please, I'm not giving any medical advice. This is what our patients have fed back to us and our experiences, and from meso themselves, it will puff up around there. Now, if it's an allergic reaction, please definitely go get medical help. But that puffing, that edema, it is possible with that application. Irritation. There's going to be itching. There's going to be stinging. There's going to be burning. There might even be a little rash. Now, not all rashes are always bad either. Some just mean the skin is being stimulated. So this is why we say when you're selecting that candidate for that Cosmelan or Dermamelan journey, you really want to be mindful that it's someone who's familiar with that skin turning over. If they are afraid of that skin turnover or not familiar with it, this is going to blow their mind. So you need to do your due diligence, get that client ready, make sure that that client is going to have a good experience so you don't have to handhold, because the better prepared, the less chances of this happening. And then, of course, the flaking. We're renewing skin. The skin's got to come off. Now, yes, in Cosmelan, you're not going to, some may not severely heal off. Everyone's going to be different, but you're still taking off and correcting. So that rate of exfoliation is going to vary for every journey. However, to manage it, just take your fingers when they wash their skin, and if they can tolerate it, use the brightening foam. If not, use the Hydra Vital Cream Fusion. So there's options for you. But you can just take your lukewarm fingers with water and just do a light circular motion like a gommage to remove some of that flaking. And with your daily wash too, you will get some of that flaking residue off. Okay. Dehydration. This is probably one of the number one factors for me where people are getting too much stinging, too much this, too much irritation. The products hurt when I put them on. Again, new baby cells. Give them a chance. Keep them hydrated. Give them power to accept these amazing actives from the Cosmelan 2 and Dermamelan treatment cream. So please keep that skin hydrated. This will help with that redness, with that irritation, with all those skin reactions. Now, sometimes we do need a little extra help. Though Cosmelan and Dermamelan are formulated to be safe, effective depigmentation method for that melanin-based hyperpigmentation, for most of these people that use our system, just increasing that melan recovery and introducing that anti-stress mask, which is the best friend in these journeys, is enough. But in those cases where that skin needs a little more help, we can help them. But again, you got to get them before I get into those products. You need to get them understanding that they have to comply. That set the tone with that consultation, get that skin prepared, follow up with visits and pictures, and be transparent. Give them that information, check up on them. Use pictures as a tool to encourage and to track and show them how that process is going to work. Lightening, darkening, lightening, darkening. And of course, most of all, keep those goals reachable. I love these examples of the verbiage. I like to say that using Cosmelan or Dermamelan is very much like a round of antibiotics. When you're using antibiotics, you must use it as prescribed. The dosage, the frequency, and the duration and how much you use. Same thing with Cosmelan. You got to complete that home protocol as if it was an antibiotic. Use it till it's completed. You cannot stop after you see the brilliant results halfway through, because when you fail to comply in that process, like an antibiotic, it can come back. So this is a very powerful image to relate to clients. Another one, you can talk about baking as opposed to cooking. So making a souffle with that recipe and having to worry about that cosmetic, or not cosmetic, but that chemistry of reacting and puffing. You need to follow that baking recipe to get those reactions. Whereas in cooking, you want to switch out the seasoning, that's okay. So this is like a baking recipe. Follow it as it wants with the right amounts to get the end product you want. In this case, a clear skin or a coffee souffle when you're baking. So those are two nice examples to use. And of course, pictures worth 1,000 words. Make those appointments, get them to send in photos. You take pictures and use it as a tool. So you're supporting products. As I said, if you need the support, I always love to recommend that anti-stress mask for the depigment journey. It is fantastic. Everyone needs a weekly mask, so this way they can use it on a weekly basis in those few days and weeks in the beginning where they're having more time tolerating those actives. You can use it even daily if necessary. That skin balance, of course, 3 drops, poosh, gets rid of sensitivity. So this is like your 911 on the shelf. Have it available for your clients. 3 to 4 drops will do you. HA Densimatrix. This is going to answer the question of hydration. You can use it to just take away all that dry, itchy irritation and helps with even when it stings going on. So do your actives first, follow up with the supporting products. And for those that want to get rid of that flaking fast, control the flaking, you've got your fast skin repair. Beautiful to fix that barrier quickly. Hydrovital factor K is that extra nourishment. So that night cream or day cream over your Cosmelan 2 and Melan recovery to give you more moisturizing nourishment. And once you've done your cracking and peeling, the hangover remedy, the proteoglycogen ampules are fabulous as a weekly treat. You can use half a vial or a whole vial. Not on that open skin, though. Wait till it recovers from that initial cracking and peeling. But a beautiful addition to just give the skin extra boost along that journey. On the crystal fiber mask, again, another beautiful treat. You can bring them into the office and do a hydrating facial later in their months of treatment after the initial correction, or you can sell them individually to send them home. And you have to know that Nuvior is always here to support you. We do have these amazing new Academy webinars, which I hope you love. And we do have the digital and hard copies of our meso material. We do sponsor special events. We're going to have Mesoestetic coming to talk about Cosmelan online this Wednesday. So if you haven't signed up, do so. And of course, you've got that education team here at Nuvior. We've got your back. We offer continuing educational sessions that are complimentary. Just reach out online, go to our website, use it. It's got great resources for you. And we even got things like this, our infograph that I can send to you if you don't already have it. But just remember, this deep pigmentation journey is as individual to every client as is their skin. In general, prepping, preparing, getting that client focused and understanding what the journey involves will give them a better experience and enhance that outcome. Understand and be transparent about those potential skin reactions and talk to your client frankly about them before they come up so they can expect them and know what to do to manage them. And we've given you all the tools to do so. And bottom line, prepare that journey. Just like you go and make a list for your vacation, fix that face, get it prepared, get them acclimated, get them ready and focused. Trust that system, trust the science, follow the steps, and experience the deep pigment journey. The results are spectacular. So that brings us to the end. I want to thank everyone. And as a token of appreciation for joining our webinar, please scan that, fill out our survey. As a client who owns their own clinic, you can receive 5% off your next clinic order for joining us today as a thank you. For everyone who is a professional at one of our product partners, please create your own personal account on Nuvior. Get in touch with one of the team members that you know, or just call up our general number and get yourself approved for 20% off clinic pricing for your personal use so you can try and love our Cosmelan, Dermamelan product supports and other products from Mesoestetic. Again, I'm Pina Lee, and I thank you for joining me. There's my contact information if you'd like to reach out. I am going to text you back, so please text me. And if you have any questions before we go today, just pop them in here at the chat right here. And if you have any questions, I can answer you. And if there are no questions, I want to thank everyone for joining us today. I hope you learned lots about the journey and the experience of the Cosmelan, Dermamelan client as they do their home procedures. And I invite you to join us on Wednesday for our Spain global trainer who's going to talk us through Cosmelan the way they do at Meso Corporate. And next week, we're going to complete our 4-part journey. What happens beyond the depigmentation journey? What next? So see you next week. Have a fantastic Monday. And we're here if you need us. Bye-bye.